Good afternoon, everybody. Thank you so much for joining us. My name is Carol Bruska, and I'm the clinical director of ABQ StreetConnect. We're so happy to be here today and tell you a little bit about our program and our partnerships that we have, and how we've been able to use those partnerships for the success of our individual clients. So I would like to welcome all of our panelists. I'm just going to introduce them quickly, and then our navigators will quickly introduce themselves, and then we can get into the real meat of our presentation today. So, like I said, I'm Carol Bruska. I'm the clinician for the ABQ Street Connect team. We have Jody Jepson here. She's the director of our program. We have Judy Bartlett. She's the data manager and the evaluator. She's the one that puts together our reports, collects our numbers, makes sure that we're actually making progress. Then we have Teddy Rivera. She is here, and she is our SOAR representative, and she'll tell everyone a little bit about what she does. Then we have Lieutenant David Widener of the Southeast Area Command, and Officer Vic Olvera from the Downtown Public Safety Department. Lastly, for my introduction, we have Jen Martinez. She is our program director. She's been here just a short time, but has been a wonderful asset to our team. And then go ahead, UNM navigators.
Well, I'm Shelby. I'm on the UNM contract.
Hi, I'm Brianna. I'm on the UNM contract as well.
I'm Kathy Sotelo. I work the Valley.
Hi, my name is Josh. I'm Kat's partner, and I also work the Valley with her.
Jennifer Regan, downtown.
Jason Jackson, downtown navigator.
I'm Leland. I work the Southeast navigator.
And it looks like we have one more navigator that wasn't able to join us. That's Marlene. So she's probably out doing some hard work. So thankfully, Leland does have a partner, and that's Marlene. And maybe you'll get to see her the next time we're on. Take it away, Jody.
Thank you, Carol, and thank you to all the panelists as well. So real quick, we just want to show you a video of some of the individuals that we serve, and it'll include some of our partners. Everybody in the video has signed a photo or a release. So I just wanted to let you all know that, and we are ready for the video. Thanks, Kim. StreetConnect serves people who experience chronic homelessness together with mental illness, typically with co-occurring substance use disorders.
Can we hear it?
Many are high utilizers of the criminal justice, emergency medical, and/or emergency departments. But just as concerning, some have never or rarely accessed healthcare. Heading Home is proud to offer this type of data-driven, prioritized outreach. The highest utilizers of emergency systems are our clients. Our team serves 120 clients per year. Albuquerque Police Department and the University of New Mexico Hospital, they determine who we serve based on their high number of utilizations.
Can we hear the video, everybody? I just, before I continue, I want to make sure that we can hear it. Can somebody confirm that you have audio? It's
Yes.
cutting in and out. You can. Okay, great. Okay, we're going to continue. I'm sorry.
Our team is dedicated to the Southeast and Valley area commands, the downtown, and the University of New Mexico Hospital. The funding that we receive is from the city of Albuquerque and the University of New Mexico Hospital. After we identify our clients, we start to engage them. And the navigators are primarily working in the field. We literally walk alongside our clients and we meet them where they're at, physically and mentally. During the engagement process, we are constantly assessing proper placement based on the individual's needs, with the goal of always providing permanent housing as the solution. The road to permanent supportive housing, it's not an easy process, and often an individual will have several different types of placements: jail, shelter, streets, group homes, hospitals, the psychiatric hospitals. Sometimes it can take months or even over a year until an individual is stabilized and placed in proper housing. But this consistent support that our navigators provide, it's essential to the success of the program, that and the team, they never give up. Our team is comprised of 13 dedicated and compassionate individuals. Each day the team shows up ready to work together, and we meet the needs of our clients. At Heading Home, we value deliberate care and kindness in the way that we treat our clients and staff. The daily interaction and behaviors of our clients can sometimes lead staff to experience vicarious trauma, high stress levels, and eventually burnout. The Albuquerque StreetConnect leadership is proud to be supporting the complete health and well-being of our navigators. This is due to the acuity and the complex need of the individuals that we serve. It's imperative that we provide ongoing training and monthly support. The work we do for the most vulnerable, forgotten population in our community would not be possible without all of our community partners and your support. All right, it's a little snip of what we do and the amazing folks that we get to walk with every day. So one of the main reasons why Albuquerque StreetConnect has been so successful is really due to the partnership with the Albuquerque Police Department. And we originally started off as a pilot specifically in the downtown about 3.5 years ago. And it's so great to have Officer Alvera on. We've been working with you, Vic, for a few years now. So if you just wouldn't mind sharing just some thoughts and anything else you'd like to share with us and the folks that are watching about our partnership.
Sure. First of all, I just want to say I'm very pleased to be working with Heading Home and other resources with the downtown area. I think we've built a great, partnership between each other and try to bridge that gap between law enforcement and having resources for people. So we have had numerous occasions where we refer, people to you guys, and we have seen, the success. I mean, we have people that I know for a fact that have been, housed permanently, and the ultimate goal I feel with Heading Home and APD is just like I said, permanently get them housing, and give them a worth, their own place to be and really be comfortable and have a nice warm shower and be in a safe location. So, I appreciate all the hard work that you guys do. You've always answered the phone call whenever I've called, and I truly appreciate that. And you've always been there, to bring clothes to people in need and shoes. And that's another thing that I think that we're trying to bridge the gap with, just trying to help people out in the streets.
Thank you. I really, really appreciate that. And one of our more recently, we have been able to expand into the Southeast, into the Valley. So we actually just rolled out our Southeast team 2 weeks ago, and we've already had some great success in partnerships with some of their folks that they've identified that are potentially a community safety concern or a concern for themselves. So Lieutenant Widener, we so appreciate your time, sir. Can you just share a little bit about our new partnership? Excuse me.
Sure. I've heard a lot of the success that the downtown team has had working with StreetConnect. I'm excited to be over here in the Southeast working with the project response team is what they call it now. So we, like you said, we had our first meeting 2 weeks ago with the Southeast. We gave you a couple of the names that came to our mind. We had a meeting last week. The navigators already followed up with 2 of our clients that we suggested and provided them with apartment or hotel rooms. One of the individuals, here in the Southeast, we probably on a daily basis get 3, 4, 5 calls for service a day on that person, which takes multiple officers out of the field just to deal with the one person, just because, you know, it's unpredictable behavior on a lot of the individuals that StreetConnect goes out and works with. So it really frees up a lot of officer time here in the Southeast to let the officers respond to more priority significant calls.
That's great. Yeah, we're really excited to be part of the Southeast team now. So thank you so much. And what I think really another vital part of our model and the reason that our clients really can start to sustain and stabilize is because it's referred to as SOAR. I'm going to introduce to Teddy Rivera, who can kind of go more into that, but it is just such a vital piece of our work. So Miss Teddy.
Okay, thank you. SOAR stands for SSI, SSDI, Outreach, Access, and Recovery. And what we do is many of our clients are suffering from either physical or mental health disabilities, and navigating the Social Security system can be very difficult for a normal person. So what we do is we apply for Social Security disability for our clients, and then that allows them, once they're approved, it allows them stability. They can pay for some of their housing. It really, truly, truly changes their life.
Yeah, and what SOAR really allows us to is then to, depending on where the individual's at in their path, we can usually secure housing and placement much sooner once they secure those benefits. So it's just so important. Last but not least, of course, is Miss Judy Bartlett. And we've just, since the very beginning, excuse me, of ABQ StreetConnect, we just felt it was really important to invest in having a program evaluator on staff. And to date, we have completed 2 annual reports, and I'm going to let Judy talk about some of that and some additional things that you feel would be helpful, Judy.
Great, thanks, Jody. Can everybody hear me?
Mm-hmm.
Good. So I wanted to just give you a quick peek into the last report that we published last fall, just to give you a sense of what we're doing and why we're doing it. So last fall, we published a report that was based on both qualitative and quantitative data. So for the quantitative data, we're getting healthcare information, jail information, EMS information. For the qualitative data, we did 7 interviews with stakeholders, including Teddy and Sergeant Peter Silva from APD. So I just want to give you just a tiny flavor of what we found in that report. So the goal of it was, first, we wanted to describe the program, we wanted to describe our clients, but we also wanted to assess the impact of the program. So I want to show you some of those results. And then our last goal with the report was we kind of wanted to really name and identify the systemic barriers that our folks are finding, because it's one thing to have a program like StreetConnect, but we also have to keep chipping away at the systemic barriers for these folks to get the care that they need. So we tried to name and identify those, as well as put forward, forward-looking solutions to chip away at those. If it's okay to take another minute, I'll just quickly show you guys some quantitative results from that. I'm going to try to share my screen here. Let's see, let me share. So I think the first thing I want to show you is some of our quantitative results. Can everybody see the screen in front of them? Awesome. So I want to draw your attention to what's in yellow. I've just thrown up a lot of numbers and it's kind of hard to parse, but I want to talk you through it because I think it's really important, both that StreetConnect is putting themselves out there and doing these measurements. I think it's really key, and it would be great to see this done over longer periods of time and more programs do this type of thing. But the idea is here, let's just focus on the row that's the emergency department. So what we wanted to do with the emergency department is we wanted to see, did our clients' use of the emergency department change once they entered the StreetConnect program? So what you can see here is, if you look at the before column, this number 6.8. I won't highlight it because it seems to make things go wacky, but you can see before our clients entered StreetConnect, on average, they were visiting the emergency department 7 times per year per client. So a lot, right? You can kind of think of yourself and how often you've been to the emergency department. And then if you look at the period after they became part of StreetConnect, that decreased from 6.8 to 3.8. So in other words, it decreased by 3 visits per client per year. And those are pretty dramatic results. I don't know how well versed you are in these numbers, but that's pretty dramatic. And I think what we were especially pleased to see is not just that the emergency room visits for behavioral health and mental health issues went down, but importantly, that the outpatient, the non-ED outpatient visits for behavioral and mental health issues went up by the same amount. So I'll stop sharing my screen there just for a second to let that sink in. So the idea is they're not going to the emergency room, but it's not like they're not going anywhere because these are folks that need care. So they're actually now going to appropriate outpatient behavioral care. So that's a pretty dramatic quantitative result, and we want to continue to track those types of things. But I also want to give you a flash of the qualitative side of it, because we did these really in-depth interviews. Teddy was one of them. We interviewed a couple navigators, we interviewed a payee, and we interviewed Sergeant Peter Silva from APD, of course. And let me just quickly share my screen and I'll show you a quote from Sergeant Silva. I thought it was really powerful. So during our interview, he said, establishing a relationship with a client is a long process, but when StreetConnect succeeds, then APD stops getting all those calls about this individual creating problems downtown. Of course, now it's beyond downtown. He continued to say, people experiencing homelessness, mental illness, and addiction need services, and providing these services has just as much an effect or more than writing citations or making arrests. So I just wanted to give you a glimmer of what we do with these annual reports that we put out.
I really appreciate that. I think it's really important to look at every community stakeholder, and that we all have a piece in this, and that we do have that we have a solution, and we can just stay and work hard and make things happen. So I appreciate your guys' time. Just a quick note before we open it up to questions, I think. Let me see here. So a great way to support heading home is to donate. And right now we are having a Mother's and Father's Day challenge. Just a heads up that if you do make a donation, your donation will be matched dollar for dollar. So if you want to invest in a really good cause and help us continue to do our work, it would be greatly appreciated. So thank you all again. And I think are we up for some questions, Miss Carol?
Yeah, Jody, I'm going to put you on the spot. I'm actually Judy. I'm putting you on the spot, not Jody. Judy, do you have the numbers of how many clients we have served since we started? I don't know if you have that answer, but it just occurred to me. People might be interested to know the number of folks that we've served.
No, I think that's a great question. For the report that I was just talking about, we were able to evaluate 53 people that we had served since fiscal year 2017. And as of today, right now, I know just within the city contract, we have something like 75 people that we've served this fiscal year, just to give you an order, and that doesn't include our UNM contract.
And so that fiscal started in July, and we just added on the 2 new teams. So basically, the 2 new teams have only been on for a couple, 3 months or so. So I just wanted to point that out because that number might seem small to everybody on here, but the intensity of the work that our navigators do, that's a lot of folks that we've touched. That's a lot of folks, and really done some amazing work. We've gotten people that have been living on the streets for years and years and years, and now are in their own place in more suitable housing, whatever that looks like. But I'm trying to toot the horns of the navigators who have done some wonderful work. So good job, navigators, and Teddy for the SOAR work.
Nick?
Well,
Carol?
yeah, we are ready. If you guys have, questions, or if you're curious about, more details or anything like that about this program, feel free to type them in chat right now. Here, let me see. I see Leland has his hand up.
Leland.
Okay. For his virtual hand.
I'm sorry, guys, that was an accident.
Oh, come on.
All right.
Well, and I think maybe while we're waiting, I can just mention too, Carol, you bring up a really great point is that, in the video, it was kind of spotty, but I did note in there that, so 2 navigators are assigned to an area command, so Southeast Valley and downtown, and then we have our UNMH team. We serve 30 individuals per year, and that's very strategic and intentional. Like Carol was saying, the acuity and the severity of some of the individuals' backgrounds and trauma. I mean, it's really building relationships and building trust, so we can even start to get them to sign a piece of paper, and that might even take a week or 2, and sometimes even a month. So we are fortunate enough to just work with that number of folks. But that being said, it does take quite a bit of effort and daily strategies and partnerships to really have the outcomes that we've been that we've shown. So it's a lot of work.
And so if you are
Questions?
around the city, particularly the Valley, Southeast, or downtown, and you notice someone that you think, wow, I wonder why StreetConnect isn't working with them. Just because they're still downtown or in the Valley or in Southeast doesn't mean that we're not working with them. But like Jody said, it can take a long time for us to build trust, because many of the people experiencing homelessness, particularly those that are experiencing mental illness as well, are not so willing to trust because they've been let down time and time again. So when we offer something, in their mind, they're thinking, yeah, that's what everybody else said, and here I still am. So when we're working with an individual and trying to get out there and give them support, give them a motel room, some opportunity to meet with Teddy, some food, an opportunity to get housing, their first inclination is more than likely, that's what everybody else has told me and I'm still here. So if you are seeing individuals who you think, why is the StreetConnect working with them? We could be working with them, even though it doesn't look like it from what you're experiencing.
All righty. We've had some time for some questions to come in. So Hannah has a question. She has 2, actually. Actually, I guess it's 3. So first, how many navigators are there total? You guys have just, been picking at things people want to know, I guess. So how many navigators are there total? Are you planning on expanding to other areas of Albuquerque? And also, how have the lives of the people served been improved outside of the increase in outpatient mental health support? How else have their lives improved?
Yeah, so right now we have a total of 8 navigators. 6 of those are through the city contract, and the other 2 are through the University of New Mexico Hospital. So we have a total of 8. How the lives are continue to stabilize, I think that's what I heard, Nick, after their stay. Is that, sorry?
Yeah, it was. So it was. How else are their lives improved outside of the increase in access to outpatient mental health care?
Yeah, so we do operate off the evidence-based practices. So housing first, harm reduction. Basic needs are being met, and then what's been really great is working with our partnerships with Caseman Behavioral Health, Dr. Swala Abrams, Lindsay Fox at the UNMH Medical Clinic. We really focus on psychiatric and primary stabilization first. And then over time, what we've seen is that they start to stabilize and start to integrate back into the community in different ways, whether that's through attending groups or going to groups or a different network, social network of folks to be a part of. And also, we've also noticed that a lot of our folks more recently have been in touch with their family. And this has been a really cool thing to be a part of. Family that they have not talked to in many years. And so that's a few ways. And if anybody else would like to share what their thoughts
Jody,
are.
I'll just chime in with, I was
Yeah.
looking at our past report. You know, obviously one of our key outcomes is housing. And we were able to find that 57% of the population that we studied with that report received permanent housing. And of course we want that to be 100%, but it's actually fairly remarkable given the population and its needs.
Thanks, Judy.
All right. So another question in the chat is, Judy touched on the qualitative interviewing done with the StreetConnect stakeholders. And Christy is wondering if you've considered doing similar semi-structured interviews with clients and bringing their voices into the conversation and what that might add.
Do you want me to answer that one, Jody? I think it's a wonderful idea. I know before I came on board about a year ago that there's been some work done talking with clients, and of course that's so key. I think it's something we should probably revisit again soon.
All right, and then we have a few getting asked in our Q&A section down here. And so Joseph asks, where can we learn more about the UNM navigators? Or is there a way? Or probably just our website, I imagine, correct?
Yes.
You can head to our website at headinghome.org. That has up-to-date information on all the programs. And if you know, you want to reach out to the Albuquerque StreetConnect team, calling us at our office is the best way. Or sending Judy an email, or Jody.
Yeah, and I just could make a quick note on that. So with the University of New Mexico Hospital, they actually give us 30 of their individuals that are high utilizers of the emergency department and psych emergency. And so they have a list that they give us, and then those 2 navigators are assigned to that list. And so an individual will go into the department, whether that's the ED or psych emergency, and they have a system internally that flags, and then they reach out to myself or to the navigators, and then we start our engagement, if that helps a little.
Yeah. All right, this is a pretty great question. It's coming from Nikki. So it's, how do you think StreetConnect can help create more trust in the community and APD, given the relationships and long history that marginalized communities have had with police, including, you know, this includes race, mental illness, poverty, homelessness. How do you see Albuquerque StreetConnect affecting these kind of relationships?
Well, I'd like to start, and then please any other feedback. I think one of the biggest things that we saw specifically in the downtown and having the partnership with the officers in the downtown is once you start to create solutions for the individuals. And what I mean by that is there were individuals that the law enforcement were getting calls on day in and day out, and they necessarily weren't law enforcement calls. And so what we were able to show is that by having StreetConnect resource there out in the field with them, engaging these folks, it really allowed the officers to do law enforcement work, but it also created an opportunity to build the relationship with the officer and the individual that we were going to serve. Day in and day out, there are an amazing law enforcement officers out there who we get the opportunity to work with, who are very passionate and who genuinely care about the individuals that are experiencing homelessness with severe disabilities. And so what we saw is the morale shift within the officers in the downtown. And I think once you get an opportunity to get the for the morale to kind of shift, and that we're making not change not only with the individuals that we're serving, but as a community, with the businesses, with the people that want to frequent the downtown. You start to see a shift, and I think that's just been an amazing experience for me to be a part of. Not just within serving our folks, but as a community. I don't know, Vic, if you wanted to add to that, just from a law enforcement perspective, and what I hope to happen by doing our work and walking along, not only with our clients, but with the officers, that'll continue to, the culture shift will change.
Yeah, so I started a couple years ago with downtown unit, and I've been in patrol my whole life, and so it's awesome that working downtown, I've been able to meet some of the clients and it's first name basis where they recognize me as well, and then from there we kind of trust each other. And I know for a fact that there's been several times where me and some of the our people downtown start services somewhere else, and they'll usually give us the downtown unit a call, and we're able to build that rapport. And because we have that trust with the people, with them, they're able to trust us, and we're able to de-escalate the situation to where use of force situation could happen. But when we get there, they trust us, they know us, and we're able to de-escalate the situation, and we're able to get them the help that they need. Like you said, not all the time it's good law enforcement related. It's just a simple, maybe they need to get their medication back on track. And so, potentially it could be use of force, but seeing us gives them the confidence that they could trust us, and how we operate, and we know that we're looking out for the best interests to serve them and to get them the help that they need. So to me, I feel like it's a unique position to be in, to talk to them on a day-to-day basis, and like I said, just be pretty much friends with them, and to know that what we could do to help them out, and what we could do to make them succeed in the future.
Excellent. All right. We are at time. We have one more question, and I think that this one can get answered pretty quick. It's from Rick in the chat. It was, does the emergency response data for behavioral health issues include all calls for police response? Or, and this is me expanding on this question, or was that emergency room trips in, ambulance by care responders, or is that a police response call? Or is there data for that?
And Jody, I think I have this right, but maybe I don't. So we had all healthcare utilization data from New Mexico's Health Information Exchange network. So that was everything. In terms of EMS, in terms of emergency management system, we did not get that from APD. We got that from the EMS division. So it was just related to the calls that they received. And I'm not so clear. I don't think that includes all of police. Is that right, Jody?
Yeah, no, one of the things that we did do, Judy, is we were able to look at the number of arrests in regards to the criminal piece. So we were able to show the decrease in arrest over a certain time frame. So there's different ways that APD, AFR, and hospitals track data. And one of, I think we're all learning is that there's identifiers for certain calls for service. And so maybe an individual who's experiencing homelessness isn't as easy to identify or track as a hospitalization or an ED visit. And so that's just something that we're just, over time, we're going to learn and work together to try and capture it better. So is that right, Judy?
Yeah, I just wanted to add that we looked at the change in use of jail as well.
Yeah.
Excellent.
Yep.
Well, I think that that's just going to about wrap us up. You can go ahead and take this on out, guys.
All right. We so appreciate you guys. Be well. Thanks, APD. Bye-bye.
Thanks so much to all the guests who showed up. Thanks everybody for attending. If you need more information or are curious, head over to our website or give us a phone call. We're down here. So we'll see you guys next month.
Bye-bye.